everyone. Welcome to the Cognitive Corner podcast. I'm your host, Anvi Chaturvedi, and today I'm joined by Dr. Kaushal Nanavati, a physician, educator, and wellness leader whose work focuses on helping people understand well-being as something we practice, not just something we talk about. He's the inaugural Assistant Dean of Wellness at SUNY Upstate Medical University, Director of Integrative Medicine and Survivorship at the Upstate Cancer Center, and the author of Core 4 of Wellness series, which explores nutrition, physical exercise, stress management, and spiritual wellness. Through decades of clinical work, teaching, and public speaking, his work centers on a simple but powerful idea that well being is something that anyone can learn and strengthen over time. I'm really excited to explore what that looks like in real life, especially for young people. So, before I get started, I just wanted to thank you so much for being my guest today and give you the chance to introduce yourself and add anything that I wasn't able to cover.
I think what hit me the most was you said decades of the work. That makes me seem old, but I'm just older. That's it. No, it's a privilege to be here. And I think some of the things that you've been doing and your interest, and I love the generational interest in all of this because I think when younger people understand what well-being is, it shifts the journey, and it shifts the intensity of the experience towards one that invites greater joy in people's life. And really, that's the goal, both as a physician, as a parent, as somebody who has a little more life experience, to want to just, leave the world a little bit better so that the next generation doesn't have to necessarily endure um, the same things that we've had to, through our life
Yeah,
experiences. And I think every generation kind of wishes that for the next generation. Sometimes, it happens, right?
yeah, definitely. So one of my first questions for you is actually kind of related to that. So what first drew you towards focusing on wellness beyond just traditional medicine? And was there like a specific moment or experience that made you realize that treating illness alone isn't enough for you?
So since I have decades of and I'm pleasing.
Hmm.
It's not one thing. What happens, at least in my journey, what's happened is growing up, you experience different things,
Hmm.
successes and failures as you deem them to be. And over time, you realize that if I stay stuck mentally in the space of what I consider to be a failure, rather than reframing it as something that's been a lesson, kind of Kobe Bryant used to say there's no failure as long as you're learning something, you've already improved from where you were. And so early in my life, I think having been an immigrant, trying to learn the new language and the accent of the region, the local region, etc., the foods, the culture, all of that stuff, start to teach me, just how to be not only more resilient but malleable and having the ability to adapt to environments. And then as I got into medical school and started working with patients, one thing I realized was expectation gets to be heavy for people. And what often happens is that many of us hinge our happiness, our joy, our definition of success on outcomes. And so what happens when that outcome isn't achieved is we feel a loss, a less than feeling, or a failed feeling when in fact we put our best effort in, right?
Yeah.
So the science actually says that when you hinge your happiness or your sense of success even on your input, and what I like to say is if you redefine success as the achievement of contentment and peace, well then that shifts, how we live the journey out. And I
Hmm.
minored in philosophy in college, so I studied the Bible and the Old Testament and the Quran, the Hindu Gita, a lot on Buddhism. And they all come back to some very basic fundamental principles. I think when I was studying it, I wasn't thinking about the medical application as such. When I started practicing medicine, I couldn't not share, right? Greater
Yeah.
wisdom. And so I think my journey ever since I was a medical student has been one that helps people, whether it's my patients, my peers, or in leadership roles of people that I work with on my team, to help them understand that, there's a joy to be had in the work that we do simply by celebrating the effort just as much.
Hmm.
Outcomes are dependent on multiple factors that we don't always control. However, if we continue to focus on the journey and finding joy in that. And then at the end of each day, if we can make each day better than when we started it, then what happens is we look back on a life that's much more fulfilling.
Yeah, I definitely agree with what you said. Like a lot of people tend to put their value into like the outcome, like whether that starts at like a young age in school or like even like in professional careers. So like I definitely agree that people should focus more on what they put into it.
Well, and it's the standards we
Yeah.
set, right? In school, what do we do?
Mhm.
We give you grades, right? And if
Yeah.
if the grade's not this, then it's not good, or you're somebody else is better than. So we
Mhm.
put people in the mindset of better than, less than, right?
Yeah, definitely.
Versus, am I better today at the end of the day than when I started? Did I learn something new? Am I building, if you put the focus back on self-development,
Mhm.
versus the comparator, right? And we say, well, the challenges help us to improve. Yeah, so we can challenge ourselves based on who we were that day versus the less than better than with the person next to us, right? Because now what
Yeah.
happens is we don't like them suddenly, right? Right?
Yeah.
And it's like,
Yeah.
wait a minute, they're better. Oh my
Mhm.
God, I'm jealous, or I hate them, or I'm depressed, or I'm sad. I'm not as good as. And the reality
Yeah.
is all of us, all the branches of a tree grow in their own direction, right?
Mhm.
If we're only comparing them to the one, right, then that's not fair, right? And it's not
Yeah.
actually healthy either from a social context.
Yeah. I agree with everything you said. And like more in terms of like how you talked about like you studied all those different like religious books, but you didn't really think about it before you like started applying it in like a medical setting. How did shifting into like integrative medicine change the way you like understand and treat patients?
Right? Integrative medicine, more than anything else, really helped me to continue to focus on root cause. Like we learn
Hmm.
to ask questions to understand what the problem is. But like if somebody in medicine, if somebody has a diagnosis of hypertension, right, or diabetes, the instinct conventionally is, even in our textbooks, there's a first line of treatment is always the word lifestyle, but it's one
Hmm.
word. And then you have like 5 pages of different medications and, things that we do medically, clinically. And I always wondered why. Because when you actually start to impact people and help empower them to actually have the ability to take care of their own self, right? What it does is it gives a person more confidence, right? More
Yeah.
self-worth, more self-value. So I think integrative medicine taught me that we talk about mind, body, spirit, and the whole being. But in addition to that, the fundamental piece being root causal factor. And oftentimes the root causal factor lies either in a life story, right? It
Hmm.
lies in a person's perception of their life, but also physically, right, and how they feel their body and the biochemical impact that that has, and what they value, right? What's their purpose? What meaningful contribution do they want to make? Like these are all things that come up in conversations that start to help people to focus on the lived journey that they're creating versus necessarily the lived journey that's been, right?
Yeah.
So it's a proactive health promotion mindset that I
Hmm.
think integrative medicine really got me focused on that more.
Yeah, I like am also interested in going into medicine in the future, and I think that's something I definitely want to keep in mind, like when I go into medical school or like in the future, that like it's more than just like the science and the textbooks, like you said.
It's a human condition, right? So we
Yeah.
talk about things like in public health with social determinants of health, right?
Hmm.
Which are root causal to a person's journey.
Yeah.
And those
Hmm.
are generational sometimes, right? So in Native American tradition, they talk about seven generational thinking. And so every choice and decision you make, if you think, how's it going to impact 7 generations down the road? But then you also think, let me learn about the 7 generations that have been. How was that journey? Because that also can impact me, not only genetically, but also in terms of social context.
Yeah. Yeah, I think that's interesting, like how you like look at all these different cultures, like that's really interesting to learn about. And then going more into like the book series you have, I read it into that a little bit, and it was super interesting to learn about the Core Four series. So, do you mind like explaining a little bit about like the Core Four of wellness and like a simple way for anyone in the audience who wants to know more about it?
Yeah, so actually, my son right now is 24. When he
Mhm.
was about 2, I started writing this book, maybe 3. I started writing this book for him, kind of just as a guidebook, right?
Mhm.
Of the things we can do to have a healthy mind, body, spirit, to have contentment and peace in our life. And as I started to write it, my wife would review it and then help edit it and, give me feedback on does it make sense or not? Is the languaging, and she's not in medicine, so she gave me a very much lay perspective on either I get it or I don't.
Mhm.
And so over time, suddenly he was 14, and my wife was like, "Are you ever going to finish that book? I'll publish it for you," right? So
Yeah.
we did it together. She helped edit it, and then she learned how to publish. And so we self-published the first book, which is the core four of wellness, and that's nutrition, exercise, stress management, spiritual wellness.
Mhm.
And in order, in kind of to summarize it even more simply, as you said, what can people get fundamentally? I think 7 servings. I say live by the sevens. 7 servings of vegetables a day, one measuring cup of raw or half a measuring cup of cooked, and the evidence actually bears this out for chronic disease, cardiovascular disease, cancer risk, all-cause mortality. So it's really amazing and fascinating that vegetables can do that, and primarily raw, some cooked, right? But 7 servings, and then within that, 3 servings of cruciferous vegetables: broccoli, cabbage, cauliflower, kale, spinach, Brussels sprouts, asparagus. And when
Mhm.
I was younger, I wasn't the biggest fan of Brussels sprouts. But if you cook them right, they taste great, right?
Yeah.
Broccoli, at my institution, I'm known as the broccoli guy. People literally stop me. One patient actually told one of my partners, "Hey, I saw Dr. Broccoli, right? That's who you're talking about." I'm like, "That's great." So the vegetables really matter in nutrition.
Mhm.
There's a lot more, obviously, but that's one of the biggest pearls. The other 7 is 7 hours of exercise a week, moderate intense physical exercise. That actually has benefits that, go well beyond anything else. If you were to pick one thing, that physical activity really makes a huge difference in longevity, if we talk about it that way, which is the telomeres within the cells that actually are the clock, helps to keep them healthy. And then at the same time, cancer risk, cardiovascular disease. What's exercise? Walking is good enough. Just going at a moderate intensity where can speak in small sentences and not long-winded conversations like I'm giving you right now, right? And so that's important. And then 7 hours of sleep a night, right?
Okay, yeah.
And that makes a big difference too. And again, younger people need more, right? The teenage brain is developing, needs a lot of energy. Plus, you're studying all the time, and sleep is actually a great time for memory to lock into place, right? That's
Yeah.
why even naps, like 20-minute naps, are actually great for retention and recall. And then the last part really is the spiritual wellness, which is about contentment and peace. And that's not like one thing you figure out on a mountaintop at some age and then that's it. It's a dynamic throughout your life, right? At your stage of life, being in high school, right? Contentment and peace means something different than at my stage of life, right? And so we have to come back to this, almost like a 5-year plan or even a 1-year plan sometimes, of what does this year look like? What does contentment and peace mean for me? And then you come back to even this week, this day, right?
Yeah.
And sometimes when you're feeling distressed, you think, in this moment, what might contentment and peace look like? And suddenly, you're not thinking about the thing that's distressing you. You're actually thinking about the thing that's going to give you joy, right? And so our mindset shifts, but just in that changing that thinking, cortisol goes down, the stress hormone, right?
Okay.
Serotonin goes up because now you're thinking about something positive, right?
Mhm.
And so you're literally changing your biochemistry, and those chemicals here actually affect the biochemicals in the gut and the gut microbiome, the bacteria, your digestion, right? Which is your highway of nutrient toxin exchange. So one thought can actually literally impact every cell in your body, right? It's fascinating, right?
Wow.
Yeah.
Yeah, that's actually like insane to think about how all these things are connected. Like I definitely have to work a lot more on my sleep. That's something I've like struggle with, like getting enough sleep. But yeah, like you said, like I definitely feel like when I'm like happier, like I feel healthier versus like or like when I think positive thoughts versus when I don't. So
Well, think about the
yeah.
doing more versus the being more, right? I was that
Mhm.
high school kid, who took, a bunch of AP classes and
Yeah.
had my goals in mind of what I wanted to do, where I wanted to be. And
Mhm.
then when I look at life now, a lot of the plans that I had didn't ever come to fruition, right? Life
Yeah.
changed, right? And
Yeah.
so the idea of instead of just focusing on doing more,
Mhm.
being more, right? Which is actually being present, right?
Yeah. Mhm.
Celebrating this versus always focusing on that. Because if we focus on that, then when we get there, we're going to focus on the next thing, right? So we're
Mhm.
never actually embracing this because our mind is always on the next thing, right?
Yeah.
So learning that idea of mindfulness or being present is really important because what it does do is actually gives us fulfillment in life,
Mhm.
versus feeling half empty, right?
Yeah. Yeah, that's a really important point. And I wanted to ask, like, in your experience, like, by working with patients or just in general, like, have you seen people focusing more, like, on certain one of these, like, core four um, points of wellness or, like, neglecting others? Like, have you noticed people focus more on one more than the other?
I think everyone has their thing, right?
Yeah.
Everyone has their thing. So there are people who come in, somebody who had rheumatoid arthritis who was in a
Hmm.
wheelchair in their 50s, right? And for them, what turned out to be shifting from the SAD diet, as in standard American diet, to the Mediterranean diet, within a span of 6 weeks, they went from a wheelchair to a walker. Within
Oh,
3 months, they
wow.
were using a cane. And at
Hmm.
9 months, they were able to get on the exam table by themselves and get off some of the medications they were on. That was pure nutrition, right?
Wow.
And then I have people who, for them, the mindfulness piece is really important,
Hmm.
because fundamentally what they want to do is, when they have stress or distress and depression and anxiety are, high, especially right now for many, many people, not just in the United States, but around the world. And as we think about it, we come back to this idea of first pausing and then looking at, what can I do in my immediate vicinity, which is one, in my own mind, right? The
Hmm.
second thing is within my own home. The third is within my community. And if people start to engage in this way, what happens is if all of us do it, it shifts the way we relate with each other and the community we create, the culture we build over time, right?
Yeah. And one thing I wanted to like talk about that you mentioned a little earlier, how like a lot of people, especially my age, I've noticed they like know that it's important to like I guess like get enough sleep, eat vegetables, but they don't actually like practice it and they don't practice what you said about how like be focus on the present instead of always just focusing on the future. Like what would you say to those students? Like how would you say that I can like help motivate my peers maybe to focus on these points more?
Well, I think the thing is like, especially with nutrition, oftentimes, or even exercise, or all of the core four,
Hmm.
people suddenly think, well, I gotta change.
Hmm.
I gotta change it, and so they want to do a 180-degree change. That
Yeah.
is really heavy, right? That's heavy.
Hmm.
If you do 1 degree of change, right? So even if you say, you know what, I don't eat vegetables a lot. I want to just have one serving of vegetable a day to start with, right?
Yeah.
And then you pick a day or 2 days of the week where you're going to prep for the rest of the week, right? So if
Hmm.
if Sundays and Wednesdays are your days, and Sunday you prep some, cut up some carrots or cucumbers, put them in little containers in the fridge, right? Meal prep.
Yeah.
Now, each day you're just taking that, putting it in your lunch bag, right?
Hmm.
Wednesday I'm going to plan Thursday and Friday, right? And then the weekend comes, right? So then you can prep again, and now you've got it in your schedule, and ideally you put it on a calendar or on your phone as an alarm, right? And so then what
Hmm.
happens is you got these reminders, right? So the
Yeah.
1 degree of change is probably the first thing I would say is pick one thing, right? Even pick one thing a month that you want to do. And actually, the science says that on average, it takes 66 days to form a habit. Some people will form them earlier, some people take longer, right?
Hmm.
The key, 66 days is, 9 to 10 weeks. So that's like getting close to 2.5 to 3 months, right? And so
Yeah.
if you think about there is you have to be patient with yourself. So the one day we miss and we're like, you know what? I didn't see, I screwed it up. I messed up, right? Well, the champion is the one who gets back up one more time, right? And so what we do is be the champion of our own habit. If I have a calendar, I just put in there, check, 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 X, check, 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 X, right? And then
Hmm.
I look over time and I have more checks. I'm going into forming that habit. And then I can look at why did I have the X? Oh, because we went out to dinner, or, we were out of town, or so if you understand that there are going to be some exceptions, but you're consistent, being more consistent, that's the first thing, right? So
Hmm.
the idea of the 1 degree of change is really, really important for them to start with. And then the other point is focus on your input,
Okay.
right? The
Hmm.
outcome, passing test, failing test, did you learn something? Are you better today than you were yesterday? Over time, that will work. And then if you don't quite get the result you want, it's okay to pause. Asking for help is probably the second thing that I would say is really important because many of us don't know how to ask for help and don't want to ask for
Yeah.
help, right? Because we feel like that would show a weakness,
Hmm.
right? The reality is, that actually shows a strength of self-confidence to know, hey, I want to know this, I don't get it. When I go grocery shopping, I go to the customer service desk and I ask them where the things are that I don't know where they are because every 3 months my grocery store moves stuff, right?
Yeah,
And
same.
so, yeah. So
Yeah.
rather than walking around for a half hour, what I'm going to do is say, hey, listen, here's my list. Where's this stuff? I see the vegetables. Where's this stuff, right? Because I don't want
Hmm.
to go in the middle aisles as much as I can avoid it. That's where a lot
Yeah.
of unhealthy stuff is. But it saves me like 10 minutes or 15 minutes, which is my time, right?
Yeah.
So proact instead of react, all right,
Hmm.
is a good way to think about it. Asking for help, asking a question is very important. And for high schoolers, the thing I'll say is study skills, right? Mastering how you learn. Are you visual? Are you auditory? Do you need to do things 10 times? If you know how you learn and you master that habit, then what happens is you can learn anything. And
Yeah.
if you don't get it, you can ask for help, right?
Yeah, I think that's an important point. Like people my age, I feel like, especially like the peers around me, I noticed that like a lot of people are afraid to ask for help, whether that's from like a teacher or like a parent. So I think people definitely need to work on getting the courage to ask for help.
And we all do. Our my age people
Yeah.
need to do that too, right?
Yeah, definitely. And like more about like how students at school like or everyone faces stress, but like more specifically for students, like do you think like stress and burnout affect people more based on like their individual issues or shaped more by like the environments people are in, or do you think it's more of like a 50-50 type of thing?
Yeah, no, it's very interesting because you think about stress, and when people are stressed, right,
Hmm.
they're looking for immediate relief, right,
Yeah.
versus kind of the long term, right? So we think about, a coal goes through stress to become a diamond, but part
Hmm.
of the way through the process, if it crumbled, then it's never going to be a diamond, right?
Yeah.
But it's thinking, I need to get out of this right now, right? And the reality is that there's something called eustress and distress. So distress, right, is the stuff that weighs us down, overwhelming. Eustress is actually good stress, right? And the way we shift distress to eustress is to recognize that here is an opportunity versus, and even a challenge, right, that I'm proactively engaging in now versus feeling overwhelmed by it being pressed upon me, right? So
Hmm.
again, your mindset of how you approach the situation matters. That's one thing. Like deadlines, right? You got to test, you got to study, right? The thing to do is to plan ahead because once you take a test, most people are stressed after the test. Thing is,
Yeah.
you've already taken it, right?
Yeah.
Now it's time to move on. The time
Hmm.
to have some eustress, which is the proacting, you know what, I'm going to study so I can do well. That comes beforehand. But most
Hmm.
of us, after the thing, get stressed. Oh
Yeah.
my God, I wonder how I did. I wonder what happened, right? And it's like, at this point, you did your part, right? Trust your effort. And if you don't trust it, then reflect on what you might do the next time to have better study skills, right? And then
Yeah.
you move on. And in life, that gets us most further, right? So it's that stress causing people to focus on the short term and trying to find the quick exit. And sometimes that leads to not as good an outcome for them, right?
Hmm.
Burnout is an occupational thing, actually. So burnout isn't something that like, I'm burnt out from, home, right? Burnout has to do with a lack of what we call self-efficacy or lack of autonomy. And when we're
Okay.
students, we don't have a lot of autonomy, right? The teacher gives you
Hmm.
the work and the assignment, the homework and the deadlines, timeline.
Yeah.
Where you do have autonomy is how you create your schedule to prepare for it, right?
Yeah.
Now, many people your age even have to work, right? They
Hmm.
may be in a distressed home environment. They may have other factors that are quite limiting, right? That create stress. Burnout, on the other hand, is the work-related or school-related type of thing. Disengagement happens, right? So what we think about with burnout and with stress is that there are two main factors. There's the individual part, but there's
Yeah.
also a system part, right? So if a lot of students in your school or in your class are burnt out, we have to think about the system. And if we think about the high school system, right, it's always a comparator,
Hmm.
right? In medical school, they actually went to the step one boards exam, making it pass fail to try to reduce the stress.
Yeah.
So on the one hand, people don't worry as much about step one, but now they worry more about step two because that's the only score they have, right?
Yeah.
So sometimes we don't have the long-term view, even from systems design,
Hmm.
to think about what are the short-term consequences going to be. until we help people to frame the long-term picture and not so much the small-term, molehills that feel like mountains in the moment. When you look at it in the long term, these are the things, the steps that build, right? If one step seems hard, right, because it seems like it's really high, and then you look up and there's 100, suddenly the one is one out of 100, and it's not as big a deal, right?
Yeah. Yeah, I think that's great advice. And how do you think schools or like any systems can support well-being in a way that like actually fits into like a student's life instead of actually feeling like another task?
So there's actually a very simple thing that can be done in most schools, but in all schools, all work environments as well, right? There's
Mhm.
something called, and this was actually studied, called the appreciation audit, right? So the thing I think about in terms of one thing, if there's one thing for well-being, gratitude is underappreciated, right?
Okay.
And it's gratitude not just for another, it can be
Hmm.
gratitude for self, towards
Yeah.
the self, right?
Hmm.
And so in this appreciation audit, what people do is take 3 minutes, 3 times a day, to just pause, right? And all they do is think about three things, right, that they're grateful for, right? It could
Hmm.
be, the necklace you're wearing or the plant behind you, right? Or that
Yeah.
we're having this conversation, right? I'm very grateful for that, right? And in that moment, just those 3 minutes of gratitude
Hmm.
actually shifts the focus, the mood, the tone, the presence, the expression, right? So the
Yeah.
communication, relationship building, and your own feeling about yourself in the moment, right? So three
Hmm.
minutes, 3 times a day was actually studied, right? And it's a simple exercise, right? Even if you make a deal with yourself that, for this month, right,
Hmm.
I'm going to every day send one message of gratitude, right, to some person. And I'll give you a little trick here, okay? So this is a trick question, right? If I asked you to take out your phone right now, right, I'm putting you on
Hmm.
the spot, right? If I asked you to take out your phone right now and text the one person you consider your most meaningful relationship, right? I love you, I miss you, I hate you, whatever your love language is with them, right?
Yeah.
Who would you text?
Um, I feel like I would either text like my sister or my parents.
Right. You
Yeah.
didn't say yourself,
Oh yeah.
right? So,
Yeah.
and people say, well, I don't text myself. I get that. However, why not?
Hmm.
Right? So our most meaningful relationship has to be with ourselves.
Oh yeah.
Because
Yeah,
we're
definitely.
in every relationship we're in. The
Yeah.
constant is you,
Hmm.
and you're the only one who knows all your deepest inner thoughts, etc.
Yeah.
Nobody else does, right? So if you don't value self, right, then what happens is whenever we think about doing, we do
Hmm.
for others, right?
Yeah.
And a tree without roots provides no shade, right? So rooting
Hmm.
ourselves, right? Nurturing ourselves. I teach a meditation that's kind of a heart-centered one, where
Hmm.
I teach that if you think about the heart as a cup, then when you breathe, just fill your heart with love, right? As you breathe, do the belly breathing slowly. Fill
Hmm.
your heart with love. Let the overflow soak you head to toe, and then all day long, the world gets your overflow. So you never empty your cup for anybody, right?
Yeah.
However, when they get the overflow, it can be unconditional, right? And if it's
Hmm.
unconditional, what they choose to do with it isn't going to be the impact on my joy. The fact that I could share it was the joy.
Yeah, I think that's great advice. I definitely want to start practicing more of that like gratitude and self-love, like you said. That's a great point. And then in terms of more of like habit formation, like you talked about previously, like you talk a lot about well-being and like being like a daily practice. So why do you say that like small, consistent habits matter more than like big changes? And what's one simple practice that you think a lot of people like underestimate usually?
So what happens, so I think the underestimating is the value of the gratitude. I think that's a really
Hmm.
important thing for people to realize. The
Hmm.
other idea is people underestimate the value of one breath, right? So
Hmm.
if I told you right now, right, to just take the longest, slowest, deepest breath in that you can, right? Just breathe in slowly and then breathe out even slower, as slow as you possibly can. Suddenly you're not thinking about what you were thinking about, you're thinking about the breath. That
Yeah.
one breath created a fork in the road, and now you get to choose what you think about, what direction you move in, right? So
Hmm.
your own breath is very undervalued. We don't think about it, but consciously coming back to your breath is a great way to reset, right?
Hmm.
The other thing I think about is that these small habits, right? The micro habits, what they start to do, they start to say, this is what I do, right? So this is my habit, right? So it
Yeah.
becomes your identity, it builds your identity, and
Hmm.
then it reduces decision fatigue, right? These guys, Steve Jobs, Zuckerberg, like they wear that black t-shirt every day, right? And the jeans or whatever pants they wear.
Yeah.
But that's what they have in their closet, right? So when they
Hmm.
wake up in the morning, like I had to think, what shirt am I going to wear, right? So pink, I
Hmm.
like pink on me. So I wore a pink shirt today, but I had to think about that, right?
Yeah.
If I had, the same consistent habit, what's for breakfast? Well, this is my breakfast. I make my chai every morning, ginger, cardamom, right, cloves,
Yeah.
cinnamon, little black pepper. But that's my routine. And so now that's my habit. And when I start doing consistently, that becomes my identity, right? And over
Hmm.
time, it leads to meaningful change, right? So, inch by inch over time, you make more progress. Mile by mile, making big changes, you
Hmm.
break it down into micro decisions. There's a book written called Atomic Habits, right? And it's really about the idea that the micro changes you make will lead to the macro impact over time. So reflecting and
Hmm.
then picking 1 degree of change rather than 50 things all at once, and then being consistent with it will form the habit. And then that habit over time will help create an identity, which over time will impact not only relationships, but community.
Yeah, I think like that 1 degree of change, like that point you made is really valuable. And I think a lot more people need to think about that because a lot of the time it's hard to start something new because you keep thinking like how difficult it'll be for you. But if people think more about like that 1 degree of change, I think it can help more people start forming those habits like bit by bit.
Yeah,
Um,
and the thing is, you assess, right? If I make the one
yeah.
degree change, and is it going in my direction of contentment and peace, or is it
Hmm.
creating greater distress, right? If it's
Yeah.
creating greater distress, like my 1 degree of change is going to be, I'm not going to do homework. Oh,
Hmm.
well, that might create a degree of distress very quickly, right?
Yeah.
So then you change. You make that
Hmm.
1 degree of change in a different direction. What direction do you go in? Go in the direction of your contentment and peace, right?
Yeah.
Redefine success as contentment and peace, and what follows are joy and happiness and satisfaction. with-
Hmm. Yeah. Well, I just wanted to thank you so much for coming on my podcast today. I really loved having this conversation with you and appreciate you giving me some of your time today. And I'm glad we were able to have this conversation. So thank you so much.
I think it's great. I think these generational conversations are
Uh,
wonderful, and we'll do some future ones whenever you wish.
yeah.
Because I think that these dialogues actually invite more people
Yeah.
into the conversation and into the journey,
Hmm.
rather than marginalizing people, right? So it's important. So
Yeah.
good job. Thank you very much. I
Thank you
really
so
appreciate it.
much.
Yeah.
Okay. Bye.
Take care. Bye.